Hi, I'm Dolores. I'm going to be performing tracheostomy suctioning. So I have provided privacy. Hi, I'm Dolores. I'm your nurse today. Could you give me your name and date of birth? Okay. Do you have any allergies? All right. Well, I'm going to be performing tracheostomy suctioning on you today. So I'm going to go ahead. I'm going to perform my hand hygiene. Okay. I am going to go ahead and put on my gown. This here. I'm going to put on my mask. Goggles. I'm going to put on some clean gloves. Pull this one by the cuff. Slide that on into this. Okay, so we got this on. Adjusting the bed to the height that I need to have it. Okay, I'm going to check the length. Okay, so we got determine the length, and that's correct. Okay, then I would connect my patient to the pulse oximeter. Okay, then here I'd like to check her vital signs. You want a baseline oxygen set, check the level, saturation level, the heart rate. We're going to evaluate her for like any obstruction or hypoxia also. So, then we would listen. Okay. I'm going to place her in a semi-Fowler's position. Alrighty. With her head slightly extended. And then I'm standing on the side that I want. I also want to check the suctioning device and have that set up to 80 to 120 millimeters of mercury. Okay. I can also have a towel placed in front of her chest. And then we're going to connect the one end of the tubing to the suction machine. And then we'll have that placed in reach. So, okay. Then I'm going to take my gloves off. Okay, we'll put that in the trash. I'm going to go ahead, I'm going to perform hand hygiene. Okay, I'm going to open my sterile kit. Okay. All right. So then I want to get the basin. You don't want to touch anything inside the basin, but just touch that up and we'll put that on the bedside table. And then we want to fill that up with 100 ml of sterile water. So, go ahead and pour my sterile water in here, 100 ml. Okay. Then I'm gonna place that over there. All right. Now that I've done that, let's see, what else do I need to do? I'm going to ask the clinician if she will hyperoxygenate my patient. We're going to do that for 30 to 60 seconds. I'm going to apply my sterile gloves first. So after I filled the 100 ml of sterile water, I'm going to apply my gloves. So that's what we're going to do right now. So she's not going to hyperoxygenate her yet. Let me do this step by step here. So let me put on my sterile gloves. Okay. Here. Okay. Then we'll get rid of this and put this in the trash. So there's my trash. Okay, so I got my gloves on. I'm gonna pick up. I'm gonna pick up the suction catheter. I'm gonna connect that to my tubing. Okay. So now I've got that to my tubing. I'm going to place the tip into this to suction it. Okay. So we got that suction. Now I'm going to ask the clinician to hyperoxygenate my patient for 30 to 60 seconds. I'm going to confirm the pulse ox reading. Okay. And then at the end of my patient's inspiration, like right now, I want to quickly and gently, I'm going to put the Foley catheter, I'm going to put the tracheostomy tube in. We've already predetermined the length. I'm not going to suction her yet. Okay. As I'm withdrawing, now I can intermittently suction it while I'm in between my fingers, rotating it and pulling it out. Okay. I'm going to go ahead and I'm going to clear this. I'm going to assess her, checking her oxygen sats. Now, she doesn't really, she's cleared it now. Her oxygen sats are back to her baseline. Looks like the heart rate and the respiratory rate is good. I've rinsed my catheter. I'm going to go ahead and put her oxygen device back on. And since she's done, I can just roll this right on up into my hand here. Just like it says. And then I can put this into my cuff and put this in here like that. Okay, I'm going to pull up from here and then I can get rid of it. I'm going to go ahead and take my gown off. Okay, so you want to shake it a little to loosen it up. Then you want to go ahead and put like a little ball. Okay. The goggles right from the ear. Put these off from the ear and in the trash. Then I'm going to go ahead and perform hand sanitize. I'm going to turn off the suction machine. I'm going to readjust the bed height, get the patient comfortable. give her her cold bell, and then from there, I'm going to document. Thank you.